Chapter 9, Teaching and Counseling. Patient teaching is the process of influencing the patient's behavior to effect changes in knowledge, attitudes, and skills that are needed to maintain and improve health. Learning itself is the process by which a person acquires or increases knowledge or changes behavior in a measurable way as a result of that experience. Attention to age and developmental levels, support networks and financial resources, as well as cultural influences and language deficits, along with health literacy can help individualize teaching and maximize the learning capacity. According to the National Health Center for Education statistics, in 2008, more than a third of U.S. adults, or 77 million people, have below a basic health literacy and would have difficulty with common health tasks. Patients learn in three domains: cognitive, psychomotor, and affective. Using a variety of teaching strategies enhances learning. Informal teaching includes unplanned teaching sessions that focus on the patient's immediate needs and concerns. Formal teaching is planned teaching done to fulfill a learning outcome. The process of patient teaching and fostering learning resembles a nursing process because it consists of several steps that are necessary to provide teaching and measured learning. A nurse coach is a registered nurse who integrates coaching competencies into any setting or specialty area of practice to facilitate a process of change or development that assists individuals or groups to reach their full potential. There are four main aims surrounding teaching and counseling, and they are maintaining and promoting health, preventing illness, restoring health, and facilitating coping. Patient education itself is the process of influencing the patient's behavior to effect changes in knowledge, attitudes, and skills needed to maintain and improve health. Research supports the fact that educated patients experience better health and have fewer complications. To be successful, patient education must be ongoing and interactive. It must also take into account the patient's care plan, educational level, and need for care, no matter what the setting or the environment. Patient education plans should be developed in collaboration with the entire team. For example, physicians, dietitians, respiratory therapists, social workers, pharmacists, etc. The basic purpose of teaching and counseling is to help patients and families develop the self-care abilities, knowledge, attitude, and skills that they need to maximize their functioning and quality of life, or to have a dignified death. For example, a patient newly diagnosed with diabetes must first acquire knowledge about the diabetes and the disease process related to medical management and self-care in order to take care of themselves appropriately. They have to value the health sufficiently enough to make certain lifestyle modifications such as attitude, dietary, and etc., and master certain skills such as medication administration. When this is all done effectively, then teaching and counseling are powerful tools to help the patient achieve their health goals. Teaching provides the knowledge that patients need to make informed health care decisions and to implement a care plan. Counseling provides the resources and support that the patient needs to participate actively in self-care and to facilitate coping with their circumstances. So when we talk about maintaining and promoting health, nurses can help a patient's value health and help their patients value health and develop specific health practices that help promote wellness. Health teaching related to health promotion is varied and ranges from things such as teaching a passive exercise to a patient with left-sided paralysis to designing a safe exercise program for a young athlete, or to teaching cooking for good nutrition to a group of middle school students. When we talk about preventing illness, educational intervention related to illness prevention, you can counsel women of childbearing ages about health practices that help promote optimal fetal development. You can teach parents how to make their home safe for a toddler. You could counsel people at high risk for heart disease, cancer, or communicable diseases, or explain preventive health screenings. When we talk about restoring health, once a patient is ill, teaching and counseling focuses on developing self-care practices that promote recovery. Pre- and post-op teaching, sexual counseling for a patient recovering from an MI, lifestyle counseling for a patient with an ostomy are all examples. So those were all examples of restoring health: the ostomy, the lifestyle counseling for the MI, and sexual counseling for the MI. These are all things that would help restore health. Facilitating coping. Lifestyle changes and acute, chronic, and terminal illnesses all put demands on patients and their family that may become overwhelming. So as the nurse, you'll not only work with the patient, but their family and friends to help them come to terms with changes in their health status or lifestyle modifications that may be required. Not all patients fully recover from their illness or injury. And as I've stated before, our job as a nurse is try to get them to get back to their previous level of functioning. Many patients, though, won't make it back to that, and they'll have to learn to cope with permanent health alterations. Nurses who are skilled teachers and counselors work to promote the following outcomes. So high wellness of related self-care practice, disease prevention or early detection, quick recovery from trauma or illness with minimal or no complications, enhanced ability to adjust to developmental lifestyle changes, acute, chronic, or terminal illnesses, and patient and family accepted of the lifestyle changes. The focus of patient education would be on preparing for receiving care, preparing before discharge from a healthcare facility, and documentation of patient educational activities. Teaching is a planned method used to help someone learn. Learning is the process by which a person acquires and or increases knowledge or changes behavior in a measurable way as a result of the experience. You, as the nurse, assume the role of the teacher, and your patient assumes the role of the learner whenever there are identified learning needs. Like any other clinical interventions, effective patient teaching demands analytic and problem-solving skills. To maximize the effectiveness of patient teaching, remember the acronym TEACH. Teaching acronym is TEACH, and it is T for tune into the patient, E for edit the patient information, E to act on every teaching moment, and C clarify often, and H honor the patient as a partner in the education process. Learning to be an effective teacher is a critical component of professional development. A basic understanding of the teaching process and learning skills will help you be a more effective teacher. The process of patient teaching resembles the nursing process and consists of several steps that are necessary to provide teaching and to measure learning. By taking into consideration the patient's age and developmental level and family support networks, as well as financial resources, cultural influences, language deficits, and health literacy, you can individualize the teaching plan and maximize learning for the patient. This will support the nursing goal of helping the patient manage his or her own health care needs. The National Patient Safety Foundation collaborated with Partnership for Clear Health Communication to promote awareness of the need for improved health literacy and to seek solutions that result in more positive patient outcomes. The Ask Me 3 is an educational program intended to promote understanding and improve communication between patients and their providers. Use of Ask Me 3 encourages patients and families to ask 3 specific questions of their healthcare providers during every encounter to better understand their health condition and what they need to do to stay healthy. Providers are encouraged to ask these questions in a clear, forthright manner. The Ask Me 3 questions are: ask me 3 questions. What is my main problem? What do I need to do? And why is it important for me to do this? The healthcare provider's response should include plain language without medical jargon. It may incorporate the use of visual models to explain a disease or a procedure and should include a teach-back demonstration that verifies the understanding of the information. No matter what the patient's age, working with the patient's family can be a great help in patient teaching. Assess the family's function and style by talking with them and observing how the patient and family interact. This assessment will yield information about family function, stress, transitions, and expectations. How can we as a nurse help patients cope with illness-related needs? The COPE model, described in the box below, is one of the methods of helping patients or family members become effective problem solvers and support your teaching efforts. This is called the COPE model. So C stands for creativity. This would help the family overcome obstacles so that they can carry out the health management and learn how to generate alternative ideas. Optimism, which helps the family and the caregivers learn how to view the caregiving situation with confidence. Planning, which helps the family learn how to plan for future problems and how to develop contingency plans that reduce uncertainty. And then expert information, help the family learn how to obtain expert information from the healthcare providers about what to do in specific situations. This information empowers caregivers by encouraging them to develop plans for problem-solving caregivers. There are 3 learning domains. People learn in 3 different domains: cognitive, psychomotor, and affective. The ability of the patient to manage their daily life and maintain or resume their former role depends on the extent to which their cognitive, psychomotor, and affective learning results in behavioral changes. Cognitive learning involves the storing and recalling of new knowledge in the brain. The patient describes how salt intake affects blood pressure. Cognitive learning includes intellectual behaviors such as acquisition of knowledge, comprehension, and application. Learning a physical skill involves the integration of mental and muscular activities and is called psychomotor learning. The patient demonstrates how to change dressings or walk with a cane. Affective learning includes changes in attitudes, values, and feelings. The patient expresses renewed self-confidence after physical therapy. Steps of the teaching and learning process include assess the learning needs and the learning readiness, diagnose the patient's learning needs, develop learning outcomes, develop a teaching plan, and then implement the teaching plans and strategies, and evaluate the learning, revise the plan if needed, then document the teaching. Additional considerations for the nurse that may affect the patient's ability to learn include age and developmental level, family support networks, financial resources, cultural influences, language deficits, and the health or literacy level. Regarding age and developmental level, people learn throughout life, although what they learn and how they learn occurs according to developmental stages. 3 critical developmental areas to consider when developing a teaching plan are the patient's physical maturation and abilities, psychosocial development, and cognitive capacity. Other concerns related to teaching learning process include the patient's emotional maturity and moral and spiritual development. Infant teaching should be directed towards the parents. Toddler and preschool's teaching is directed more towards the parents. Preschool children are often eager to demonstrate a skill they should have been taught and may ask many questions. Explanations should be short and composed of simple words. School-age children are capable of logic and reasoning and should be included in the teaching learning process whenever possible. The cognitive process of adolescents are similar to those of adults. So the content and strategies of patient teaching for this age resemble those used for teaching adults. There are some important considerations to keep in mind, however. When teaching a sexually active 16-year-old girl about contraceptive methods, you would assess whether the young patient has reached the stage Piaget refers to as formal operations, the ability to use logical reasoning to solve a hypothetical problem. If the patient's intellectual development is delayed and she is still in the period of concrete operations, use of logical reasoning to solve the issue may not be fully understood. So she may use logical reasoning to solve concrete problems, and she may be less skilled in thinking abstractly. That is, she may not fully understand pregnancy as a real possibility and therefore may not fully understand the need for contraception. So you can alter the teaching plan to include online teaching aids that are easily accessible and explain the topic in concrete terms to the adolescent. Teaching strategies designed for an adolescent patient should recognize the adolescent's need for independence and the need for establishing a trusting relationship that demonstrates respect for the adolescent's opinion. Motor development is also a concern in teaching learning process. A 4-year-old girl diagnosed with diabetes may not be able to administer her own insulin shots if she lacks the fine motor skills needed to manipulate the equipment, but a 13-year-old should be able to master that technique. As people age, their personalities and learning abilities change. So other things that might affect the patient's ability to learn are financial resources. You should evaluate the family's financial resource because the patient may not even be able to afford a new treatment regimen. If needed, refer patients and families to community-based support groups and funding resources. Cultural influences. As our society becomes more ethnically diverse, you will be providing care and education to patients from many different cultural and ethnic backgrounds. To do so, you have to be able to seek new information from a variety of sources, such as nursing literature and textbooks that describe health practices and values of other cultures. Language deficits. In addition, be sure to identify language deficits or barriers and develop strategies to address them. Clearly communicating in the nursing care plan. Do not assume that a family member is adequately translating information critical to the patient's learning. The Joint Commission added accreditation requirements that include an expectation for hospitals to accommodate the oral and written communication needs of all patients in 2011. This includes translated, clearly stated patient education information. The National Library of Medicine, through the website Medline Plus, provides patient education materials in multiple languages that include tutorials with animated graphic materials and accompanying handouts. Health literacy is the ability to obtain, read, understand, and act on health information. Health literacy includes performing internet searches, reading health prevention pamphlets, measuring medication doses, and understanding and complying with verbal health care instructions or written ones. Over a third of U.S. adults, or 77 million people, have below a basic health literacy that would have difficulty with common health tests. The U.S. Department of Health and Human Services is addressing this. Limited health literacy affects adults in all racial, ethnic, age, education, and income groups. But the older adult, those with limited education, those with low incomes, racial and ethnic groups other than white and non-native speakers of English are more likely to experience low health literacy. Federal initiatives such as the Affordable Care Act of 2010 and the National Action Plan to improve health literacy have made health literacy a national priority to improve the health of all Americans. The scope of the problem is challenging in part because healthcare information and directions have traditionally been written at a 10th grade level or higher, while educational material is generally more easily understood when written at a 5th grade level. Low health literacy affects all segments of the population and threatens the quality and safety of health care. The NVS, or Newest Vital Sign, is a screening tool used to assess health literacy. The program was developed by Pfizer to improve communication between patients and providers and can be administered during initial assessment to assess the patient's literacy skills involving both number and words. The Newest Vital Sign has been reported to perform moderately well in identifying limited literacy. It uses a nutritional label from an ice cream container and a score sheet for recording the patient's answers to 6 oral questions that refer to the label. Based on the number of correct responses, the healthcare provider can then further assess the patient's health literacy level as indicated. The time spent administering the tool more than compensates for the time providers might need clarifying a diagnosis, treatment, or medications if they had not recognized the patient's limited health literacy. The Ask Me 3 questions that we discussed earlier are part of this initiative. The science of teaching, pedagogy, usually refers to teaching of children and adolescents. In recent years, however, the study of teaching adults, andragogy, has gain more attention. Adults need to be taught differently than children. A critical component of effective patient education is the nurse's ability to be an effective communicator. Assessment parameters. Knowledge, attitudes, and skills needed to be independent. Readiness to learn. Ability to learn. Learning strengths. 4 elements should be considered in each assessment of the patient when identifying learning needs. First, identify what the patient considers of importance to learn, as well as any new knowledge, attitudes, or skills necessary for patients and family to learn in order to manage their health care. Second, focus on learning readiness. The patient's anxiety, motivation for learning, willingness to engage in the teaching, learning process, and support system contribute to readiness to learn. Readiness is distinguished from the patient's actual ability to learn, which is the third element. The fourth element of assessment is the patient's strengths. Strengths are the personal resources that can be harnessed to facilitate the teaching, learning process. A patient's health beliefs can have the greatest influence on motivation. The health belief model identifies several health beliefs as critical for patient motivation. Promoting compliance. Adherence and compliance are often used interchangeably to refer to a patient's efforts to follow healthcare advice. Both terms refer to the ability to maintain health-promoting regimens determined by or in conjunction with the healthcare provider. Compliance refers to the extent to which a person's behavior coincides with the clinical advice, implying that the healthcare provider is viewed as the authority and the patient passively follows recommendations, a paternalistic attitude towards patients. Adherence refers to the extent to which a person's behavior corresponds with the agreed upon recommendations from a healthcare provider. The term adherence supports more inclusive and active patient role, emphasizing agreement between the patient and the healthcare provider, and is seen as more patient-centered than compliance. So be sure when you're promoting compliance that instructions are understandable and support the patient goals. Make sure you include the patient and the family as partners in the process. Utilize interactive teaching strategies and develop interpersonal relationships with the patient and their family. Non-adherence or non-compliance is when the patient is resistant to following a predetermined healthcare regimen. Patients do not follow a predetermined regimen, or patients ignore instructions or not follow them appropriately. Knowles listed 4 assumptions about adult learners. So 1, as a person matures, one's self-concept is likely to move from dependence to independence. The previous experience of the adult is a rich resource for learning. An adult's readiness to learn is often related to a developmental task or social role. Most adults' orientation to learning is that material should be useful immediately rather than at some time in the future. Andragogy focuses on a specific problem or need and on the immediate application of new material. In general, adult learners must believe that they need to learn before they become willing to learn. Nurses must participate using counseling skills to motivate patients or to participate in the teaching learning process. Adults need to be shown the importance of learning new information, health practices, or skills. Health promotion and injury avoidance are important activities throughout the lifespan. Teach methods to be modified when working with older adults. First, identify any learning barriers such as sensory loss, limited physical mobility, or inability to comply with the recommended therapeutic regimen. Sensory deficits can affect learning in older adults and include the presence of cataracts that can cloud vision, a decrease in lens accommodation that necessitates adequate lighting, a decrease in peripheral vision that requires that teaching materials be kept immediately in front of the learner, or hearing loss that make it imperative for the teacher to speak slowly and clearly. Successful teaching plans for older adults incorporate extra time, short teaching sessions, accommodation of sensory deficits. They reduce the environmental distractions, and older adults also benefit from instruction that relates to new information, to familiar activities or information. These techniques used by a teacher to promote learning are called teaching methods. A teaching method is the way information is taught that brings the learner into contact with what is to be learned. Instructional materials are objects or vehicles used to communicate information that supplements the teaching method. No one method is right for teaching all learners in all settings, nor is one method more effective for changing behavior in any of the three domains. Combine methods or use one method with one or more instructional materials to meet the needs of the learner. So some sample teaching strategies include, for the cognitive domain, lecture, panel, discovery, or written materials. For the psychomotor domain, demonstration, discovery, or printed materials. And for the affective domain, role modeling, discussion, and audiovisual materials. So teaching strategies might include lecture, discussion, panel discussions, demonstration, discovery, role-playing, and audiovisual materials. Considerations for successful patient teaching. A contractual agreement. Consider a contractual agreement between you and a patient. Contracts between nurses and patients are common in many healthcare settings, and they're usually informal and not legally binding. When teaching a patient, such an agreement can serve to motivate both the patient and you as the teacher to do whatever is necessary to meet the patient's learning outcomes. Time constraints. Nurses often encounter challenges in finding time to meet with patients and to meet their needs. So consideration of time constraints is important when implementing teaching and learning activities. Set the priorities in order to teach essential content thoroughly. Less important content can be taught last, so the more important learner outcomes can be met within the available time. It's better to schedule, plan shorter, more frequent teaching sessions rather than one long session. Short sessions allow the patient to become less tired and less uncomfortable because of a health problem. So sessions of 15 to 30 minutes are generally well tolerated. Group versus individual. Several factors are important when choosing the teaching setting. Some learner outcomes are met more readily in a one-to-one encounter, where others are achieved more easily in a group. So the outcome, the patient will change the dressing using the clean technique, is best taught and evaluated in a private session. The outcome, the patient will discuss feelings about diabetes self-management, might be more met easily in a group discussion with other patients. Formal versus informal teaching. The nurse-patient interaction can include informal teaching. These are unplanned teaching sessions, and they're often effective because they deal with the patient's immediate learning need and concern. Discussion as simple as reinforcing the correct technique for post-op deep breathing exercises, or explaining or clarifying information about a schedule procedure, is actually teaching. Formal teaching is planned teaching, done to fulfill a learner outcome. Both are effective when used appropriately. Consider the physical environment when implementing the teaching plan. Some planning may need to ensure adequate space, lighting, comfortable chairs, and good ventilation. Privacy is also important, as it is free from distractions and interruptions. The nurse coaching process. With the implementation of 2010 Affordable Care Act and goals outlined in Healthy People 2020 initiative, there is a clear need to address the direction of healthcare in the future. Health challenges are more complex these days, and nurses need to be prepared to move from a disease-based model of care towards a health and wellness promotion model. The nurse coach is an integral part of this partnership and assists patients and families to make changes that promote healthier lifestyles. Nurses that incorporate coaching into their professional practice can improve the quality and effectiveness of care. A nurse coach is a registered nurse who integrates coaching competencies into any setting or specialty area of practice to facilitate a process of change or development that assists individuals or groups to realize their potential. A nurse coach establishes a partnership with a patient and uses discovery to identify the patient's personal goals and agenda in a way that will result in change rather than using teaching and education strategies as directed by the nurse as the expert. Nurse coaches may practice in a specialty area such as diabetes education or cardiac rehab. And may be staff nurses, advanced practice nurses, education, or administrators. The nurse coaching process includes establishing relationships, identifying readiness for change, identifying opportunities, issues, and concerns, establishing patient-centered goals, creating the structure of the coaching interaction, and empowering and motivating patients to reach their goals. Assisting the patient to determine progress towards the goal. The role of nurse coach is evolving and should not be confused with that of a preceptor or a mentor. A nurse coach explores the patient's readiness for coaching, designs the structure of the coaching session, supports the achievement of the patient's desired goal, and with the patient determines how to evaluate the attainment of those goals. There are several methods of evaluation for learning. For instance, cognitive domain learning may be evaluated through oral questioning, affective domain learning through the patient's response, and psychomotor domain learning by a return demonstration. Consider the learner outcome in the cognitive domain. The patient will be able to describe what a blood pressure reading represents. To evaluate this, you could ask the patient, "Tell me what this blood pressure reading means to you." The patient then has a chance to talk about the reading while you evaluate the patient's understanding of it. Providing an opportunity for and encouraging patients to change their own dressing, for example, provides concrete evidence of satisfactory or unsatisfactory performance of the procedure. However, you must take care to promote a non-stressful environment when the time comes for the patient to do the return demonstration. Most people feel encouraged and supported when their efforts are acknowledged by another person, especially when they trust and value the other person. This is especially true in healthcare, where patients often feel overwhelmed by their illness. To make most use of this dynamic, use positive reinforcement to affirm the efforts of patients who have mastered new knowledge, attitude, or skills. Evaluation of teaching must occur so that you can capitalize on your strengths and work on improving weaknesses. Like all other nursing roles, effective nursing teaching requires practice and experience. Even nurse educators agree that they are always discovering better ways to promote learning. It's important that you not feel discouraged when evaluations of your teaching are less than perfect. It's best to evaluate your own teaching effectiveness immediately after a teaching session. This involves a quick review of how well you feel you implemented the plan. During evaluation, you or your patient might decide that revisions are needed in the teaching plan. When revising the plan, you should identify teaching factors that might have reduced teaching effectiveness. Revision is a natural part of the teaching learning process and should not be viewed negatively. Neither you nor the patient has failed when an outcome is not met. Most outcomes can be met with a change in approach, although sometimes the learner outcomes may be unrealistic. Counseling is the interpersonal process of helping patients make decisions that promote their overall well-being. Counseling focuses on improving coping abilities, reinforcing behaviors, fostering positive interactions, or preventing illness and disability. Family members or significant others are often included in counseling sessions. Everyone participating must feel comfortable in the situation and the surroundings. Like teaching, counseling may be formal or informal. Make everyone feel comfortable in the situation and the surroundings. Counseling may be formal or informal. Use interpersonal skills of warmth, friendliness, openness, and empathy. Caring is fundamental in the counseling role. In counseling situations, you do not need to tell patients what to do to solve the problem, but instead act as an assistant and a guide for them to help them solve the problem and make decisions. If the patient lacks the knowledge and skills to approach a problem systematically, you can combine the teaching and counseling roles to help the patient solve the dilemma successfully. Counseling may be situational, developmental, motivational. Counseling may be situational, developmental, or motivational as short or long term. Short-term counseling focuses on the immediate problem or concern of the patient. It can be a relatively minor concern or a major crisis, but in any case, it needs immediate attention. Short-term counseling might be used in a situational crisis. A situational crisis occurs when a patient faces an event or situation that causes a disruption in life. Long-term counseling extends over a prolonged period of time. A patient might need the counsel of a nurse at daily, weekly, or monthly intervals. A patient experiencing a developmental crisis, for example, might need long-term counseling. A developmental crisis occurs when a person is going through a developmental stage or passage. For example, many women go through menopause and need help adjusting to the changes they experience. Long-term counseling may occur in the nurse-led support group. Motivational interviewing is an evidence-based counseling approach that involves discussing feelings and incentives with the patient. Some patients do not have the inner drive or motivation to cooperate in their own health care. Some patients say, I have nothing to live for. By establishing a helping relationship with the patient early on, you can help the patient work through these feelings of despair. You might be able to get the patient to talk about what is generating the lack of interest in recovery. Motivational interviewing may help the patient or family identify health goals. This is not the traditional approach, and it requires time to establish relationships, but many experts recommend motivational interviewing as an effective alternative to deal with a severe health problem. When assessing a motivational problem, always consider the patient's cultural values. Often the way the person feels about something is strongly influenced by their cultural background. For instance, if a person has grown up in a family in which illness is perceived as an inevitable result of aging, it will be more difficult to motivate that person to practice preventative measures for health. When discouraged, confer with a colleague to help solve patient-centered problems.